Welcome to the 2023 Oregon Housing Conference. My name is Jason Renaud, and I'm the convener of this year's conference. Let's thank Oregon Governor Tina Kotek, Multnomah County Chair Jessica Vega Pedersen, and Portland Mayor Ted Wheeler for showing their support for the work that we do and for joining us today. But it's important to start out this conversation about the intersection of addiction and homelessness by acknowledging that Oregon, and especially Portland, has struggled with what to do with people who are both addicts to drugs and alcohol and who are also homeless, really since white people got here in the 1820s. And by struggle, I mean we've had a protracted policy debate about what not to do that's been going on for over 150 years. How to provide the least housing, how to provide the least medical services, how to not use best practices found to work elsewhere, how to not follow the advice of experts, and mostly how to not follow the golden rule. So today is an awkward and divisive discussion, but it's nothing new. And to put it plainly, we've never done the right thing. And so no one should be surprised by the problem persisting. And so you say, well, what's the right thing to do? That's pretty simple. It's the providing effective and sufficient treatment for addiction and alcoholism. It's providing alcohol and drug-free housing for people who need it while they're in treatment and sometimes longer. The right thing to do is to provide safe shelter and a clear, well-lighted, and rapid pathway from homelessness to housing. But that's not what we've done. You know, the first institutions the state built were a prison and a state hospital, which is a prison for people with mental illness. And when those institutions were filled and the careers of thousands of people who keep those institutions up and running were satisfied, you know, we built more. We built the poor farms here in Portland and in all the surrounding counties. We built jails with drunk tanks in every county. We built the Eastern Oregon State Hospital out in Pendleton. We built Damage State Hospital in the 1950s in Wilsonville. And in our time, we built the state hospital at Junction City. Then we built more prisons and more work camps. We built a community mental health system in the 1960s and 70s, separate and apart from the public health system. And then in the 80s and 90s, we built an entirely separate system to help alcoholics and addicts. These three systems did not communicate with each other. We've built a patchwork of programs costing billions of dollars over decades, stitched together mostly by county administrators who were influenced by business interests, by unions, and by their lawyers. And what's the outcome of these programs? Well, if the outcome we want is safety and sobriety, the outcome is poor. And for many of these untreated alcoholics, a natural consequence of their disease, when it goes untreated, is homelessness. A natural consequence. It's going to be what happens. When you start to listen long and hard to the stories of people who have resolved their homelessness, and usually that factual origin story doesn't emerge until years after the homelessness has ended, the recovery is well on its way, and trauma has been addressed, is at the heart of the experience is a moment where their mother, this is an example, stood on the family doorstep and said, no, you're an addict and you can't come into my home any longer. You're too dangerous, you're too scary, and what you've done can't be forgiven today. This is the tragedy where a mother turns away a child, leaving them to the fate of the streets and to a public health system designed to fail them. That's the tragedy at the heart of our story. So here we are in 2023 with perhaps 10,000 people who will be homeless and unsheltered on the streets of Portland this winter. That's more than ever before. Perhaps 50 or 60% of those people are addicts. For some, the illness is in remission because of poverty, but for many more, it's mental illness, trauma disorders, intellectual and cognitive disorders, neurodivergent disorders, personality disorders, they dominate the decisions. And that rounds up to, in my estimation, pretty much everyone who's homeless and unsheltered. Pretty much everyone. So if you're an agency trying to help people who are homeless without also directly addressing addiction and these other disorders, I think it's going to be ineffective. If you're a public health clinical provider and not changing your practices to accommodate people who are homeless, you're really part of the problem. You see, addiction and homelessness aren't at an intersection. They are intertwined, they are entangled, and they feed off each other. So folks, if you're here today at this conference to fix this problem, for us, it's game on. It's up to us to figure this out. There's no quick fix out there waiting to be discovered. This is why we went to school, why we trained, why we work in this with these people and in this problem. And it's the spiritual center of our external character. I hope you learned something today and tomorrow. I hope you have something to take home to your colleagues and friends. Thank you.